If you have gestational diabetes, or if your baby is large for gestational age, meaning over 4,000 grams, which is, I believe, 8 pounds, 12 ounces, or small for gestational age, 2,500 grams or less, your baby will be a candidate for blood glucose monitoring. And normally what we do is we do that first blood sugar check after the completion of the first breastfeeding. So usually at about an hour and a half to 2 hours, we'll check that first blood sugar. We do that by putting a heel warmer on the baby's heel and letting it warm up. And then we use a blood sugar monitor or a glucose monitor. Okay. Now, if your baby's blood sugar is 40 or above, that's good. If it's below that, your nurse should recheck it right then, like immediately, right then at the bedside, because there is a high level of user error with blood sugar monitoring. If the heel wasn't warm, it could be a false low. If there was too much alcohol, there could be a false low. There's too many items that could go wrong. So they should recheck it right then immediately. And then if it still remains low, there is a blood glucose protocol in every hospital. The reason we're monitoring the baby's blood sugar is we want to make sure that they are maintaining their blood sugar. And if mom had gestational diabetes, the mom had not enough insulin, or their body wasn't processing insulin enough. And so the baby was exposed to those higher levels of blood sugar. So their insulin level had to rise to cope with that. Well, now baby's been delivered, they're not getting the extra blood sugar, and sometimes their insulin levels are still high. So we want to make sure that if that is happening, their blood sugar is going to drop, and we want to make sure we support them appropriately. Okay. So blood sugars are usually continued for the first 24 hours. That first one is going to be after the completion of the first feed. And the other ones are going to be right before every feed. So whenever you're ready to feed your baby, you call your nurse and tell them you're ready to do a blood sugar. Don't not feed the baby while you're waiting for them. Go ahead and put the baby on the breast, because it's not going to affect their blood sugar super fast. And baby needs to eat because we're worried about their blood sugar, right? So call your nurse. They can come in with all the blood sugar monitoring stuff. You can go ahead and put baby on the breast. It's really important to feed them every 2 to 3 hours on demand and let them get as much as they can. It's also important for gestational diabetics, and in my opinion, all moms who are breastfeeding, to hand express after each feeding. If you hand express for about 5 minutes each side, you might get a drop, you might get a teaspoon. It doesn't really matter. But 5 minutes each side after each feeding is going to do a few things. It's going to help your milk come in sooner. It's going to help it come in more abundantly. And it's going to really boost your confidence, because you're going to see that your body is doing what it needs to be doing. And so it really helps establish a nice, solid breastfeeding. Plus, it can help maintain your baby's blood sugar, because they're getting whatever you hand expressed in the spoon. So they're getting a little bit more. So as far as the blood sugar goes, we are monitoring the blood sugar, but we're also monitoring the baby's symptoms. So if their blood sugar is hanging out at a 40 or even maybe a 38 or something, but they're asymptomatic, that means they don't have any symptoms at all, we will plan to treat in this particular way. But if they are having a low blood sugar and they're symptomatic, what are some symptoms of a low blood sugar for a baby? So severe trembling, like it doesn't stop. We could have excessive sleepiness. We could have a drop in temperature, and we could have like lethargy, like they're just not acting like normal. And so we don't just look at the blood sugar alone. We also are looking at symptoms, and we're looking at the whole picture together to come up with the best plan. If your baby's blood sugar is low and they're asymptomatic, a lot of hospitals will have treatment anyway. And the first line of treatment is generally a glucose gel. And so we put the gel on a gloved finger and we let the baby suck on that, and that gets them a little extra glucose to process, because remember, their insulin levels are still elevated because of when they were in the uterus. So we want to help give them something for their insulin to be processing. Now, sometimes babies will shake, and There's a difference between the shaking because of a low blood sugar and just the normal tremors of a newborn. Remember, your newborn has a very immature neurological system right now. And so for them to shake a little bit is absolutely normal. You'll also notice that newborns have what's called a startle reflex. So if there's a loud noise or if you move suddenly, they might kind of do this and throw their hands out. That's called a startle reflex, and it's absolutely normal and it's healthy. If you are concerned about the amount of shaking that your newborn is doing, just mention it to your nurse and they can do an assessment. So as far as the blood sugars go, we'll check before every feed for at least 3 or 4 more feedings. And then if everything's fine, we will generally discontinue them. There are some providers who really would like to do 24 hours, but remember, you still get to choose what interventions or what assessments are happening to your newborn as well.